This medication is used to relieve coughs caused by the common cold, bronchitis, and other breathing illnesses. Guaifenesin is an expectorant that works by thinning and loosening mucus in the airways, clearing congestion, and making breathing easier. Dextromethorphan is a cough suppressant that reduces the urge to cough by acting on a part of the brain. It is important to read the package instructions carefully before using this product, especially if you are self-treating. This product is not recommended for children younger than 6 years, and some forms are not recommended for children younger than 12 years. It does not cure or shorten the length of the common cold and may cause serious side effects. Follow all dosage directions carefully and do not use this product to make a child sleepy. Ask your doctor or pharmacist for more details about using this product safely. When taking Vicks Dayquil mucus control, make sure to follow the dosage instructions provided by your doctor or on the product package. It's important to stay hydrated by drinking plenty of fluids while using this medication, as it helps to break up mucus and clear congestion. The dosage will depend on your age, medical condition, and how you respond to the treatment, so do not increase your dose or take it more frequently than directed. If using the liquid form, be sure to measure the dose carefully with a special measuring device. For powder packets, empty the entire contents onto your tongue and swallow without chewing, and if taking the capsule form, swallow it whole. It's crucial to not misuse or abuse this medication, as it could result in serious harm. If your cough persists or is accompanied by a persistent headache, fever, severe sore throat, rash, or worsens after 7 days, contact your doctor as these may be signs of a serious medical problem. Some potential side effects of Vicks Dayquil mucus control include dizziness, drowsiness, nausea, and vomiting. If these effects persist or worsen, it's important to notify your doctor or pharmacist. Your doctor has determined that the benefits of using this medication outweigh the potential risks for side effects for many people. While a serious allergic reaction to this drug is rare, it's crucial to seek medical help immediately if you experience symptoms such as rash, itching/swelling, severe dizziness, or trouble breathing. Keep in mind that this may not be a complete list of all possible side effects, so it's essential to contact your doctor or pharmacist if you notice any other effects not mentioned. As always, it's important to follow your doctor's instructions for the proper use and dosage of Vicks Dayquil mucus control. Before taking Vicks Dayquil mucus control, make sure to inform your doctor or pharmacist if you are allergic to Guaifenesin or Dextromethorphan, or if you have any other allergies. This medication may contain inactive ingredients that can cause allergic reactions or other issues. It's important to discuss this with your pharmacist for more details. Before using this medication, be sure to tell your doctor or pharmacist about your medical history, especially if you have breathing problems, cough with blood or large amounts of mucus, or liver problems. This medication may cause dizziness or drowsiness. Avoid alcohol or marijuana, as they can increase these effects. It's important to avoid driving, using machinery, or doing activities that require alertness until you can do so safely. Limit alcoholic beverages and consult your doctor if you are using marijuana. Liquid forms of this product may contain sugar and/or alcohol. If you have diabetes, liver disease, or any other condition that requires you to limit or avoid these substances, be cautious and consult your doctor or pharmacist. The liquid forms and powder packets of this medication may contain aspartame. If you have phenylketonuria, PKU, or any other condition that requires you to restrict your intake of aspartame, consult your doctor or pharmacist about using this medication safely. Before undergoing surgery, be sure to inform your doctor or dentist about all the products you use, including prescription drugs, non-prescription drugs, and herbal products. During pregnancy, this medication should only be used when clearly needed. It's important to discuss the risks and benefits with your doctor. It is unknown if Guaifenesin or Dextromethorphan passes into breast milk, so consult your doctor before breastfeeding. It's important to be aware of potential drug interactions with Vicks Dayquil mucus control. Taking certain MAO inhibitors with this medication may cause a serious and possibly fatal drug interaction. It's important to avoid taking specific MAO inhibitors during treatment with this medication, and most MAO inhibitors should not be taken for 2 weeks before treatment with this medication. Remember to ask your doctor when to start or stop taking this medication. Another important thing to consider is that Guaifenesin and Dextromethorphan are available in both prescription and non-prescription products. It's crucial to check the labels of all your medications to make sure you are not taking more than one product containing Guaifenesin or Dextromethorphan. Additionally, Guaifenesin may interfere with certain lab tests, potentially causing false test results. Make sure to inform lab personnel and all your doctors that you use this drug. Remember to always keep a list of all the products you use and share it with your doctor and pharmacist. And, of course, do not start, stop, or change the dosage of any medicines without your doctor's approval. If someone has taken too much Vicks Dayquil mucus control and is experiencing severe symptoms like passing out or difficulty breathing, it is important to seek immediate medical attention. In the U.S., you can call the local poison control center at 1-800-222-1222. In Canada, residents can call their provincial poison control center. Symptoms of overdose may include extreme drowsiness, blurred vision, confusion, hallucinations, slow or shallow breathing, and seizures. Always take the recommended dosage and seek medical help if you believe you have taken too much. Remember, if your doctor has prescribed Vicks Dayquil mucus control for you, it is important not to share it with others. It's also important to keep all your medical and lab appointments to ensure the medication is working effectively for you. If you forget to take a dose of Vicks Dayquil mucus control, take it as soon as you remember. If it's close to the time for your next dose, just skip the missed dose and take the next one at your regular time. Don't take a double dose to make up for the missed one. When it comes to Vicks Dayquil mucus control, it's important to store it at room temperature, away from light and moisture. Avoid storing it in the bathroom, and don't freeze the liquid forms of this medication. Different brands may have different storage needs, so be sure to check the product package or ask your pharmacist for specific instructions on how to store your brand. Remember to keep all medications out of the reach of children and pets. When it comes to disposing of the product, don't flush it down the toilet or pour it into a drain unless specifically instructed to do so. Instead, properly discard the product when it is expired or no longer needed. You can consult your pharmacist or local waste disposal company for guidance on how to do this properly. If you need more help, call your doctor for medical advice. In the U.S., you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.